Phonation is a part of the speech process. The speech process starts with respiration that provides expiratory airflow for speech, the energy supply for speech. For some speech sounds, the larynx converts that airflow into a periodic sound, in particular a harmonic series that has a fundamental frequency that creates the pitch of the voice. This is a topic that you would cover in basic speech and hearing sciences. That phonation then resonates in the oral and/or nasal cavities, changing the overall balance of frequencies and creating our distinctive speech sounds. In addition, for a few phonemes, constrictions in the oral cavity can also generate additional sounds. The phonation process starts again with respiration and expiratory airflow. Certain phonation muscles move the arytenoid cartilages in order to put the vocal folds in the way of that expiratory airflow. The interaction between the elasticity of the vocal folds, the tension of the muscles holding the vocal folds in place, and the expiratory airflow creates a cycle of vocal fold vibration. This is called the myoelastic aerodynamic theory of vocal fold vibration. Other phonation muscles adjust the length, thickness, and tension of the vocal folds to vary the frequency of vibration of the vocal folds and the pitch of the voice. Overall, the larynx is situated in your neck, in between the pharynx at the back part of the oral cavity and the trachea that we talked about in respiration. The superior margin of the larynx is the hyoid bone, and the inferior margin of the larynx is the cricoid cartilage. On most people, there is a little bit of a lump on the neck, sometimes called the Adam's apple. That is the anterior-most cartilage of the larynx, the thyroid cartilage. At the superior margin of the larynx, the esophagus separates off from the airway with the assistance of the epiglottis, another cartilage. In our image of systems, these structures are all contained within the phonatory system. So the image itself doesn't mark these extra bits of detail, but if you look closely, you can see the hyoid bone at the top of the larynx, the epiglottis sticking up in the back a little bit, the thyroid cartilage in the front, the cricoid cartilage visible at the base, and the esophagus would be just behind the trachea in this particular image. The larynx has three important cartilages in it that you'll get to know very well: the thyroid cartilage, the cricoid cartilage, and the arytenoid cartilages. There are two of those, one on the left and one on the right. The cricoid cartilage is the lower border of the larynx and connects it to the trachea. The thyroid and arytenoid cartilages sit on top of the cricoid cartilage and provide the anchor points for the vocal folds. This image that you might see on a poster in an ENT doctor's office, for example, has pretty much all of the laryngeal anatomy in it. It shows you on the left the larynx in the neck, just beneath the oral cavity and the tongue. On the lower right, we have a image of the structures of the larynx, including the major cartilages and muscles that are used as part of phonation. And then last but not least, in the upper right, there's a little cutout showing the interior structure of the vocal folds. We'll talk about all of these different pieces of anatomy in detail across the different videos. Between the arytenoid cartilages and the angle of the thyroid cartilage are the vocal folds. The vocal folds are a multi-layered complex of epithelium, connective tissue, and muscle. The epithelium and elastic connective tissues within the vocal folds can vibrate. There's non-elastic connective tissue and muscle that hold the vocal folds in place for that vibration. Vocal fold movement is achieved by sliding and rotating the arytenoid cartilages. The larynx has a variety of functions. In terms of non-speech functions, it provides a seal to the respiratory system. If you adduct the vocal folds or bring them together, you can hold your breath for thoracic fixation, or for example when you're underwater. You can also use this to cough. This seal to the respiratory system also helps prevent food or liquid from entering the trachea and the lungs. For phonation, we have control of the larynx to adjust the position of the vocal folds to create voicing, vibration of the vocal folds, creating the pitch of the voice. That provides the sound source for vowels, and voicing also differentiates voiced sounds from voiceless sounds, so things like a z fricative versus a s fricative. A z has vocal fold vibration, a s does not. This is a pretty typical view of the larynx for a clinician. You can use a device called an endoscope, a camera that gives you a view inside the back of the oral cavity down to the larynx, or there's a flexible version that you can thread through the nose to hang down the back of the throat and look at the larynx. In this view, the epiglottis can be seen at the top of the image, which would be anterior on the person's body looking down. Also around the outside of the larynx we have the vallecula and the piriform sinuses, which are channels for food and liquid when swallowing. Inside the larynx proper we have the false vocal folds and the vocal folds. When the vocal folds are open or abducted, we can see through them into the space between them called the glottis, and down into the trachea. Last but not least, the likely location of the arytenoid cartilages is indicated on this image on the basis basically of the position of the vocal folds. The vocal folds make a V shape. The point of the V is where the vocal folds connect to the thyroid cartilage, and the open end of the V would be where the vocal folds connect to the arytenoid cartilages. So I mentioned these two cavities of the laryngeal region, the valleculae, which are at the base of the tongue between the tongue and the epiglottis, with one on each side of the epiglottis, and the piriform sinuses, which are located on the posterior side of the larynx or pharynx. These are the entrance into the esophagus. There's one on each side of the esophagus, and they come together to make a channel for swallowing. Here's an endoscopic view of a different larynx. Again, looking for major landmarks. The easiest one to spot and help orient yourself is what's indicated by the arrow in this image. That is the epiglottis. Once you've identified the epiglottis, it's usually kind of white and shiny like it is here. You know which way is anterior. The anterior side is the side with the epiglottis on it, and posterior would be the other side. So in this image, anterior is up and posterior is down. This arrow points at another structure that helps define the space of the larynx. So we have the epiglottis on one side, and then forming kind of a ring around the other side. On the posterior side is going to be your arytenoid cartilages. So this points to one of the arytenoid cartilages, in this case the one that is on the left. Now that we've identified the epiglottis and the location of the arytenoid cartilages, defining the ring that enters into the larynx, this location is outside of that ring, and on the posterior side, the spaces outside of that ring are the valleculae and the piriform sinuses. The valleculae are behind the epiglottis, so this is a piriform sinus. Inside the ring formed by the epiglottis and the arytenoid cartilages, we have the false vocal folds, the vocal folds, and the glottis where we can see down into the trachea. In this particular case, we have an arrow pointing at the false vocal fold. There's a little gray shade just behind the arrowhead that is the division between the false vocal fold and the true vocal fold, which is just behind it. And then a little bit lower and to the left on this image, we see the dark space down through the glottis into the trachea.